Once again, everyone, welcome back. Our last session of the day. And I'll allow my panelists to actually introduce themselves, but the topic is Academic and Industry Collaborative Consortium. The use case, which is something that we at USC, at the Center for Global Supply Chain Management, was very successful of building the alliances with a bunch of academic partners, universities, and industries to really step in during the crisis of COVID disruptions on the healthcare supply chain. So we have Dan Bumblauskas from University of Northern Iowa, Laird from University of Huntsville, Alabama, and Sundar from University of Utah. So they'll actually give a quick introduction and talk through sort of our approach, how did we start. So I want to make this as much more sort of an interactive, where we'll go through the overview of our approach. But honestly, we spoke about it today, the industry and academic collaborations. We talked about some of the innovation. We talked about the bridge between applied and advanced research. So I think this topic really fits very well, because what you will find is it will actually touch in each of these areas through what Laird's going to be talking about with Denz and Sue when they will share their perspective. And once Dasu joins in, he'll help us as well. So with that, I'm going to roll this over to Dan, if you want to bring this up. And again, our quick highlight, as I mentioned, I will be leading the moderations, but moderating the panel rather, and you will see that what we really want to talk about is the key bullets. How can we as a universities collaborate and make an impact on a real tangible way to the problems faced by the society or even industry, right? This could be locally, could be regionally, or could be globally. How can the collaborative model that we build can be applied to other industries, right? You will see some of the points that the panelists will touch, that this healthcare model now getting evolved into the food supply chain model that we're going to talk about it. And then I think it'll be really great to share the lessons learned from this collaborative consortium model that we have that. So with that, Dan, the next slide, please.
Yeah, can you, right now you can see the slide that's got all of us, right? I just want to make sure we all see this. Okay.
And you guys are okay.
So a little bit of background, and I think that I'm going to take a step back just for a second here. As Nick said, being the moderator, we'll give you a little bit of background on this particular case of our University Industry Consortium. I don't know, just from an introduction standpoint, Nick mentioned I'm from the University of Northern Iowa. Laird, do you want to introduce yourself real briefly here?
I'm Laird, Associate Professor of Management Science in the University of Alabama in Huntsville, which most people don't know, but it's the birthplace of NASA. So if you want to figure that out, then it's easy to find us.
Sue, you want to say hello quickly?
Yes, I'm Sue Sundar. I'm a faculty here at the University of Utah, David Eccles School of Business. I'm also the director for the Operations and Supply Chain program here.
Excellent. I don't think Datsu's with us yet, but he might join as we're flowing through the presentation. The reason I step back for just a minute, I know Nick had done a brief introduction of the three of us. This slide that's on the screen now and the subsequent slide, the next couple of slides, are just talking a little bit about some of the outreach activities and engagement activities that our group undertook. This initiative was assembled to essentially provide support to healthcare providers as well as PPE manufacturers to provide flow through the supply chain of critical needed items, right? We all know the story with COVID. We've heard about it throughout the last year, really. And actually, this group was assembled about a year ago, sometime in that vicinity. Since then, and over the last year, we've presented out at various conferences, had various panels like this one of which was at DSI. I don't know, and maybe using the chat window or something like that. If you were involved in any of the other panels, you can let us know. But we did do a panel at DSI, and you can see a few more of the folks. I know Dave's been on the conference all day, I think, from TCU. And some of the others might have been on and off in terms of participants that were on the panel at DSI, and then a similar panel that was conducted at the USC Global Supply Chain Summit that Nick hosted as executive director back in October. So those two particular things were different outreach activities, this being just another one of those, to kind of share a little bit about what we did with university and industry collaboration. And we'll talk a little bit about the mission. I know, Nick, we said we want this to be interactive, so I don't want to spend a lot of time going through these slides. But in listening to our audiences from the first couple of times we presented these materials, one of the pieces of feedback we received was that someone said, it would be great if you guys had slides to talk about this. So this is where the slides came from, was actual feedback from some of the previous panels and talks we've done about the initiative. Nick, did you want to say anything overarching about how we established this, since you kind of were the glue that brought everyone together initially?
No, certainly, Dan, thanks. So I think the mission truly, what we found ourselves in the March is that we are faced with this a pandemic, the crisis of the century. And of course, I was getting approached by small to mid-sized to large enterprises, just trying to figure out how to make the heads and tails. And I just felt at that point very overwhelmed and unprepared, honestly, to answer any of those questions. And suddenly it was that point that I truly decided to make a call, not for call for paper or call for speaker, but call for help. Meaning, hey, this is a massive opportunity, as well as a crisis at hand, and what can we do as an academic institutions, but more so, this is our passion. We use so much of our time and talent and knowledge to teach and prepare the next generation leaders. Can we really start to come together and apply for it? So the vision was really, how do we create that leadership to the healthcare industries and help them sort of create a very systemic ways to help to this COVID-19. And then we certainly focused on 3 different ways, and because this was a very complex space, and we knew that we simply just cannot address this in a one dimension. So we talked about how do we improve the fidelity in forecasting? How do we match the imbalance between supply and demand? Because there was a huge gap, right? The demand was astronomically getting high by the minutes, and then the supply was getting constrained, right? How do we create the execution plans? And how do we really help this industry that has been caught off guard, has no knowledge about last mile delivery, does not know much about the export because they've always worked in the distributor model. And certainly my association affiliations with the Department of Commerce and White House in terms of how do we engage some of the opportunities at the policy level to help drive some of the decisions. So that was sort of a holistic approach, but that was all I did. Rest, my colleagues from industries, and then they'll talk about more. They literally stepped in and we all came together to really deliver this. Then back to you.
You're being modest, Nick, you're being modest. And maybe I'll say a few words, and then Laird and Stu, if you want to chime in here in terms of some of the things that I know. One of the things we've spent a lot of time talking about as a group, especially in the more recent time period, is what makes this collaboration unique compared to other university, industry, government collaborations. And for us, looking at just the way that we've been able to engage holistically with all of the entities, I think early on in the process, I like to tell a story where we were literally running around at the county city level, helping people align manufacturers, suppliers with healthcare providers to get masks, gowns, materials in. Very, very grassroots, boots on the ground, supply chain sort of stuff. And then saying, what can we do to make sure that, you know, we solve these problems in the short run, but then in the long run, how do we make sure we don't get into this same predicament again? Some states, some counties were more well-equipped than others to deal with it. And so as we got all the groups together, it was obvious that some of the stakeholders maybe didn't have as in tune supply chains that they thought they did. Some supply chains seemed to work, some said they didn't. But we'll talk more specifically about how we broke up the 3 streams. Laird or Sue, do you have anything you want to add in terms of the partnership here before we keep moving?
No, I think we're good. We can keep moving, and then I can step in when we talk about Steve.
Stream 2. Good. All right. So some of the supply chain challenges that we saw was we had these communication entities where some of the local state governments maybe weren't all communicating with their providers. There were, for example, I'm in Iowa. We were lucky that we had stockpiles of materials from the swine flu left over. So we were one of those states that had materials, but they maybe weren't being distributed to that through that last mile that Nick referred to. So we literally had the mayor of Waterloo, Iowa, hand delivering things out of a truck to some of the hospitals, things like this, where some of the mainstream distribution, some of the medical supply distribution was okay, but also from a forecasting perspective, not knowing exactly where we would need it, when we would need it. So some of these things, wrong place, wrong time sort of idea, a lot of chaos going on, right? And while some states had surpluses, other states had shortages, same thing at the county and local levels. So getting everyone involved to both handle the things in the short run, right, execute tactically, but then also look at those forecasting PPE models that we get into in stream 1, some of the supplier engagement sorts of activities in stream 2, and then that kind of first mile, last mile, everything in between logistics of stream 3 as we get into the 3 streams here in a few moments. So just some of the background and some of the things that we set up initially in terms of setting up priorities. You can see some of the initial priorities here, developing some models, and Laird, I'm sure, will chime in at Datsu, joins us a little bit more on the models that we used. Then Sue will get into some of the ways that we broke down our network of suppliers and how we established that. And then I'll talk a little bit more about these logistical challenges that we encountered: import, export, custom clearances, getting things through to the final, that last mile delivery, and then providing an infrastructure that could be used for the future for other things. And of course, I think Nick already mentioned a few minutes ago, food being a natural bolt-on to what we saw here in terms of essential supply chain need that we have in that space. Phase 1 was to get everyone together and to create these streams and creating essentially chairs. Now, what I'd say one of our maybe call outs from this particular group of supply chain directors would be, if you're interested in engaging with us, of course, follow up with Nick and or any of the rest of us, but let us know how you are interested in engagement, opportunities for potential engagement in your areas, etc. So we'll kind of keep going through each one of those initial streams. Laird, do you want to kind of take over a little bit of stream 1 overview here? Laird, you're on mute, the infamous mute.
As somebody earlier said, they saw a t-shirt saying you're on mute, which is a perfect description of the times. So in stream 1, we started, maybe to step back a little bit, we started with what areas do we need to focus upon, and forecasting came up, as did the availability of supply and matching demand, et cetera. And so as stream 1 evolved, we started looking at how do you do the forecasting. There are certain models out there, and as good old dedicated academics, all of whom had our plates full, as well as our industry partners, we stepped in to do this and probably got a little too ambitious, because we started looking at some really cool, really sophisticated models that were really helpful, but that they were a little more detailed and would take more time to develop. So more recently, we've stepped back to set up the fundamental aspects of the models, to look at the forecasting by region and by locality, so that not only can the large medical centers, if they need it, but more likely the small to medium-sized medical centers and hospitals have the ability to say, what forecast can we have? Because as we've all seen, the coronavirus infection rates, we're using SIRS models. So you've got susceptibility, infection, response, and recovery. And so as you look at these models, you see these going up and down. And we've watched this with the Johns Hopkins and other models for months now. And how do the local areas know what kind of demand they may have for PPE, this personal protective equipment? And so we're working to finalize that first initial set of models so that we can help feed stream 2 to say, given that you have certain demand, say over the next 12 weeks that is forecast, what can they do to try to match supply and demand, both in terms of finding the available suppliers that may exist or are emerging suppliers, as well as moving into the last mile. I know Sri's not with us right now, or Dasu, but Nick, did you want to add anything to that?
No, so the only thing is really, so when you start to get into the modeling, we can spend years building the sophistication And then the key that I think what I walked away in terms of the lesson learned is that the solution on hand, or maybe it's not the optimal solution, it's better to put that in place and then to do the future iterations to optimize it incrementally than to wait for that ultimate solution. So I think that's probably, Laird, if you agree, something that we will reflect on it in other solutions that we go after in this collaborative effort, is that it's good to get the first version up and running and start to take advantage of it.
It is, Nick. You know, the military says, give me 85%. Don't wait for 100%. Give me 85%. So we need a workable initial solution. I agree with you 100%. In fact, just as an aside, many of us are multitasking, doing a lot of things at the same time. I'm participating in 2 international conferences, this being one of them. The other one is a complex systems group out of Arizona State that I was lucky to co-found in 2007. And they have some superb modelers. So Nick, I do want to mention, they brought up food supply chains. And I said, I know the consortium you might want to talk to, but again, it comes back to that ambition. We had great ideas and we had a lot of energy, but we were all running at about 100% bandwidth. And so we had to come back and say, let's take the step back, get the basic fundamental model working, get it so that hospitals and medical providers and others can get to that model, and then move into stream 2 to look at how do they balance the supply and demand, particularly for the non-large regional medical centers that don't have enough buying power to do that. And maybe that's a good segue into stream 2.
So Laird, I don't know if you want to talk a little bit about some of the specific modeling. You already alluded to this before we switch over to Sue for stream 2, but anything you want to add here on, we got a few charts, I suppose, that we could talk a little bit about.
Yeah, if you have those, you can bring those up.
Yeah, I don't know. Can you all see this first chart here, which was the kind of first half of the year county level analysis for the base?
So this is standard logistics model, which says that we start with an infection, we get this exponential growth. And as you've seen now, this was the first 6 months in 2020. We've seen it ebb and flow. We've talked about the various peaks and the resurgences. And we just had another peak, and we may, in fact, be dropping down. It appears we are, but some states are now relaxing their mask requirements. So we'll see whether they continue to come down or some continue to go back up. This particular model is a model, an SEIR model, SEIR model. And when you look at these models, they're equation-based models for those of you that are interested, where we look at calculating who's susceptible and who's got infections and recovery, et cetera. And the first models we looked at were the SIR models, but we realized that we have to actually look at the exposure part. That's where the E is. So it's not just that you're susceptible. We had to move to a little more sophisticated model that talks about the rates of exposure and then the rates of transmission upon exposure, which drives the infections and then the recoveries. And so our first set of models was that. We then started looking at some very interesting, sophisticated models through USC, looking at even local population parameters where we could get Apple and Google and other data anonymized for cell phones, but we could look at interactions. And as we go through these particular interactions, we can get some really high fidelity, accurate predictions. But to do that, we discovered it's going to take a lot more time to calibrate because we have more than 3,000 counties in the United States. So it's one thing to set it up and test it around USC in Los Angeles, but it's another to try to have a model that can apply across the country. And so we learned the hard way, if you will, that while we can look at these very interesting interactions that help with the exposure and the infection rates, that level of sophistication takes much time to develop. And I do want to point out that as we go through this, we didn't just want to respond to this particular pandemic. We also wanted both a model of how to do a consortium with industry and government and academia. And we also said, another pandemic or some other event like this may arise. And so we want an architecture for how to address that. In fact, this T-shirt's from the University of Michigan's Complex Systems Group, where I happen to do some grad work. And I just saw a couple of days ago a state-of-the-art model by two of the finest modelers I've ever seen, an epidemiologist and another gentleman, Dr. Koopman and Dr. Simon, Carl Simon, who's got 49 years in this. And they're looking at the transmissibility and the waning of the resistance and other factors. And while they won't make a prediction, it looks like this particular pandemic is going to be around for a while. So it's going to be waxing and waning and doing other things. It may taper down a lot, but it's not going to go away in the foreseeable future. And so we want this to apply to this on an ongoing basis, but also develop better models for the next supply chain crisis. For example, as we may talk later about the food supply chain, we'd also like to be able to model some of those aspects as well. And you'll see on the next slide that you look at this particular crowdsourced information. We look at the crowdsourcing and the exposure and then the recovery rates of these. And we can see that we get some complex distributions that in many ways can be mathematically modeled, but there are some cases that are not lending themselves well to mathematical models, where we can go to tools like agent-based models, which happens to be my background and the background of some other folks that part of the USC team. And so we're scaling our approach back to the basic level and then also planning for how do we go to the next level of sophistication, because it's likely, as you've seen with the policies across 50 states, they vary significantly, as do the ebbs and flows of the infection rates and the recoveries, as well as the vaccine rollouts. We're going to have to get a little more sophisticated, every few months in these models to keep track of the evolution of this pandemic and the responses to it. Any more, Dan or Nick, that you can see?
Oh, that was perfect. Right.
Yeah, and I guess that is a good segue. Thanks, Laird, for sharing all that background. Sue, do you want to talk a little bit about the second stream now?
Yes. Can I share my screen, please? Thank you. All right, so I'll pick it up where we just left off. And so we had, after stream 1, we had stream 2 and stream 3 at the same time, doing our things, so we could sort of put the puzzle together and help move forward here. So just to go back to what Nick and Dan said earlier, basically the background is on March 11th, 2020, the WHO declared COVID-19 as a global pandemic. So that was official. And we brought about this consortium, this amalgamation, this partnership between industry and university folks, that we came together and we created these different streams to be able to solve our problem. Now, what was the problem? The problem was that we had a gap between the supply and the demand for PPE and ventilators. There was a huge gap there. And like we talked about, like Dan mentioned before, there was chaos, basically chaos everywhere. There was price escalations, there was surpluses and shortages going on. And if you go back to this slide from MGMA, which is the Medical Group Management Association, on March 19, 2020, they came up with this, where they said that 89% of healthcare providers say that they're facing a PPE shortage due to COVID-19. Now, this is a huge number. And this is exactly what Nick was talking about, that when he was getting those calls and he created this consortium to see how we could help as industry and university experts here, to see how we could help and do our little bit to solve this problem where 89% of healthcare providers are saying we don't have this basic PPE and ventilators that protects patients, but also protects healthcare providers. So we can't afford to lose our healthcare providers because they're not protected. So this is the CDC's, as far as PPE is concerned, the kinds of stuff that we needed, that we talked about, where we had certain places where we had, some companies that had shortages of some of these PPE items. Some of them had surpluses of some items and shortages of the other items. Now, how do we bridge the gap? How do we make sure that the people who have excess and the people who have a shortage of the same item can talk to each other? And that's what Stream 2 did. Stream 2's goal was to bridge that gap between the supply and the demand. And how do we do that? By creating an information portal. And that's exactly what Stream 2 was. It was an information portal that helped basically help the healthcare providers, the suppliers, to talk to each other, people who need it, and also people who had an excess of it, and people who were suppliers all over the world that could talk to each other, find a way for us to connect them, make it easy. And then if I could come here, if I was in need of, say, gloves or special kinds of masks or a face shield, I could come here to this portal and see who were the suppliers that would have this readily available, so I'm not losing precious time. All right. So let me move on to the next slide. So how are we, one of the things that I was thinking about is, yes, this started exactly a year ago in terms of this becoming an official crisis. So this became a crisis officially more than 12 months ago. And so where have we reached since the 12 months? And so this graph basically helps us do that or understand that. So this is as of this morning. CDC's website shows us the trends in the COVID-19 cases in the United States. And you can see here in January, the week of January 11th is when we peaked this year. So not very long ago, last month was our highest peak in the COVID-19 cases, which is scary, very scary to think that even after several months of almost being 1 year in this COVID-19, we saw the peak still happening so late in the game. And so this goes to show that what we are doing right now is very much needed, that we continue with this. We can't basically, relax at this point. And here's another slide that talks about the variants. Now we have another problem. Now, as we're getting vaccinated for COVID-19, we also know that there's a variant, and there are 3 kinds of variants right now that are throughout the world that we see happening. And this slide shows us the emerging variants in the United States and the color coded. So the darker the color in terms of blue is where we have more of the variants happening as of today. This is data as of today. All right, what about vaccinations? In terms of vaccinations, we see that almost 68 or more than 68 million people have been vaccinated in the United States. Again, this is data as of this morning. But we continue, our need for PPE and ventilators continues. And even given the variants, that makes our problem even more complex, given that we don't know how things are going to pan out. Are they going to get worse with the variants? Or is the vaccine going to protect us against this new variant or not? And the other question is, how soon can we get all vaccinated? Not only in this country, but across the world. How soon can we make that happen? Here is, again, a daily trend in the number of COVID-19 hospitalization, hospital admissions in the United States. Again, you can see that peak happened in the middle of January, which is quite scary that even after having struggled with this for almost a year, we are continuing to see this happen. This is a trend in the deaths across the United States. So that's about it for our team. And I guess we feel that we were able to, through Stream 2, we were able to help a little bit in bridging this gap between this huge need that was there and bridging the gap between the supply and demand for PPEs and ventilators. All right, so I can now I can stop sharing my screen and turn it to Stream 3.
Right. take back over here, so bear with me for a second. All right, can you see my screen again, everybody? Good.
Yes.
All right, thanks, Sue, for filling us in. So as we looked at what Laird talked about for Stream 1 and some of the modeling and taking a step back and assessing which models work best in the short and the long run, and then talking through some of these challenges with suppliers and working and connecting suppliers with providers. While Sue was talking, I put the website that was on the main page into the chat window, as well as the link specifically to Stream 2, where Sue and the colleagues in that stream built out a repository for buyers and purchasing agents and suppliers to connect in that venue. So that was someplace we could direct them to. And keeping in mind, we were doing this all on the fly very quickly. So in terms of all three streams executing. In fact, Stream 2 and Stream 3 had a lot of overlap initially. And we essentially started to break them down, looking at particularly some of the inbound, outbound logistics. So when you connect the buyers and the suppliers, and they're purchasing something, how do you know that that is something that's not counterfeit? It's certified, the source can be confirmed. One of our very early discussions was, how do we make sure from a liability standpoint that we're making sure that folks are protected? Because you've got to go through that due diligence to make sure that you're not buying counterfeit items. We heard a lot about counterfeit items early on in the pandemic as there were shortages. So as we started to build this out, Stream 3 eventually kind of broke into looking at that import, export, and compliance with documentation, regulations from the FDA and others as it relates to inbound, outbound shipments. So that initial placing an order kind of is where we started to see that delineation between Stream 2 to Stream 3, the handoff happening, right? So we've now found our suppliers. If we're the buyer, we've got that PO going, things are moving. Now that shipment goes out, and we go, now where do we go from here in terms of delivering through? So as we started to work through this particular part of the initiative, we had a really, really robust team of our industry and university folks who then connected through their network with others, medical distributors, and as well as the demand and supply side of the equation. One of the things that stood out to me during a lot of those initial conversations with the distributors was this sort of, I suppose, maybe elation that in many cases, the distributor networks were working. So one of the things we heard a lot about was there were shortages, and maybe that was because of some of that demand supply imbalance that Stream 1 was trying to repair. But when we got into the discussion with the big medical distributors, they were running full bore and things were working. Their chain, I mean, there are obviously isolated anecdotal cases of breakdowns in the supply chain, but for the most part, I think the thing that rung true in most of those conversations was we set up a supply chain network to distribute medical goods, and it is working. And it's now, is it at its capacity? Perhaps. Are there things that we can make better? Of course, always. But at the end of the day, the things were working. And even if you look at the vaccine situation, I'm in a county that's had a really, really difficult time getting shots in arms. The vaccines are there. It's more on the, we're minus 20 degrees Fahrenheit. We don't have tents to do mass tent vaccinations or drive-through vaccinations. So what do? We have to rely on our infrastructure to provide in-clinic shots in arms. That's very slow, and that's a bottleneck, right? So that's what we're seeing locally, and our numbers, especially up until probably the last few weeks, were atrocious. No one was getting shots in arms. Now we've since recovered. We've started to improve some of that, and actually they have done some of these tent vaccination setups, especially even for our healthcare employees. Some of the things that we're seeing from Texas. But at the end of the day, we saw that many of these distribution networks were working as they were originally designed, but there were obviously rooms and areas for opportunities to improve. All of the different streams trying to connect the pieces of the supply chain here. From our perspective, as we got into some of the execution of now receiving the products, right? So think about now that side of the supply chain where we're bringing things in, we have that QA, QC inspection. Back to counterfeiting, the infamous 3M, right? We got 3M logos printed on this one and this one. One is counterfeit, one is not. How do we tell them apart? Where did they come from? Right? Entire batches of things being destroyed at ports because they have the improper documentation and we're not sure. So that's one piece of it. And we met with some experts in custom clearance and what was going on at the ports to identify those things. And actually, there are a lot of good policies and procedures that are already in place and documentation. But oftentimes many of the providers maybe hadn't been working this fast and furiously, so they weren't even aware of some of the resources. So part of what we did for Stream 3 was build a repository of resources hey, I've never had to buy this fast from this supplier. What are the ability, what are the tools that I have available to me already at my disposal for making sure that they pass through import and custom as they're supposed to. We've never had to buy them from this country or this source or that source. So a lot of it was kind of managing some of these key supply chain activities that we're all very, very familiar with from our teachings, research, and industry experience and work. This was kind of an interesting attempt to kind of summarize some of how this all plays out for Stream 3. So you've got your raw materials coming in, of course, you've got your various manufacturers. One of our participants, I don't think is on the line, is with one of the medical manufacturers. So we had some representation from a medical device manufacturer, kind of going through that network of what happens next. Well, you've got your various group purchasing organizations, you've got your distribution carriers. It may be surprising, maybe not. A lot of the last mile delivery outsourced. Think about Amazon, package delivery, UPS, FedEx, those sorts of things. Penske, or someone or whoever the contractor may be that's doing that, ABF, JB Hunt, there was a lot of last mile handoffs happening, right? And so you saw a lot of the different pieces that went into that as well in terms of the final deliveries and then getting them to where they need to be in the locations. Even before the pandemic, I'd worked on various projects. And of course, the one that's always catches everyone's attention from an inventory management perspective with this network are gloves, right? Latex, non-latex, different sizes. It creates inventory management challenges when you have different grades of mask, gowns, gloves, et cetera. Even before a pandemic, it just exacerbates the situation as you get into pandemic level of this sort of network. So this was just kind of the way that we saw that. And of course, all sorts of different things going on with the different suppliers and their responses to coming up with innovative designs and the ability to supply those. So just kind of a little bit more there. This is kind of bringing all three streams back together, and part of what Nick was able to accomplish by getting the group university industry working together and kind of promoting some of the activities, creating awareness of the resources that we were creating, doing interviews with various outlets. It wouldn't be uncommon. I'd be talking to Nick, you say, I have to go to talk to CBS or someone like this, right? About something like that. So Nick, I don't know if you have anything you want to add here as far as some of the outreach. We talk a lot about public professors trying to have impact and just some of the ways we can communicate these to the mainstream media and general public, I guess, was kind of what this was about.
No, absolutely. So again, I think there was just so much confusion and so much chaos that suddenly this becomes a topic of discussions at every level about people just trying to find sort of a calmness into these chaotic situations we're looking at. So they want perspective. They wanted to hear what can we do and why these efforts are not really being duplicated across the country, and why are we not putting the resources together to bring this level of efforts, but in a greater way. So I mean, those were the opportunities that we talked about it, and I was lucky enough to share this perspective from the policy standpoint, to say that even government or the policymaker simply should not be just thinking in a vacuum, rather use some of the talent that exists on this platform. You representing the subject matter experts at the university level to actually come together and work on this in a much more succinct way.